Hello, doctors, homeopathic students, and homeopathic lovers. Today, on the 955th day of the continuous webinar, we are having with us Dr. Somashekher, who is going to take us a session on the efficacy of homeopathy and yoga therapy in treating chronic diseases, a complementary approach. He is having lot of degrees. Apart from homeopathy, he is having yoga, naturopathy degrees, and he is having great knowledge as a pediatric expert and a yoga therapist. He is running Sri Sai Hanuman Homeo Yogalaya at Bangalore, and he is the guest faculty in DHMC Bangalore. As a homeopathic pediatric specialist and yoga therapist, treating the diseases by the integrated approaches of homeopathy and yoga therapy. So we are all very keen and enthusiastic in listening about the class. So let's welcome Doctor for the efficacy of homeopathy and yoga therapy in treating chronic diseases, a complementary approach. Yeah, Doctor, you can start the session. You can unmute yourself because you're a co-host. Can you hear me?
Yes, sir. 1 second. So I'll just connecting. Yes. Am I audible and visible?
Yes, yes.
Yeah. Namaste. Happy evening to one and all. It's my privilege to take part in this IFPH organization. So I'm very happy to be a part of this. And thank you so much for giving me an opportunity to share my views in my field, homeopathy, and also in yoga. Yes, sir. Started sharing the slides. Visible to all of you?
Yeah.
Able to, yeah, fine. So myself, as sir has introduced myself, Dr. Somashekher. My today's topic is about the title is Efficacy of Homeopathy and Yoga Therapy in Treating Chronic Diseases, a Complementary Approach. Yeah, so as the title says, so I used to treat the cases, I used to look for the cases with the aspect of homeopathy, even through medicines, through homeopathic medicine. At the same time, so by natural lifestyle modification, so how we could able to engage ourselves with the medicines through yoga. So this is my concept. So where I have developed treating the cases homeopathically, at the same time integrated approach I have added as with homeopathy is yoga therapy. Since almost 28 years of my yoga experience. So when I joined for BHMS in Bangalore Government Homeopathic Medical College, so when I started studying aphorisms, as rightly said our master Hanuman. So when I think I was in a second year or third BHMS, so I could able to understand the importance of aphorism 259 to 263. So at that time, I made my mind that so how best we could able to serve the humanity through homeopathy. Yes. Along with that, it's very important to understand the diet and regimen aspect. So clearly, our master has explained in that in those aphorism between 259 to 263. So let's know about those also. So before starting, I'll thank once again. So taking gratitude, showing my gratitude to our master Hanuman, and it's the month of, we can say, Hanuman homeopathic day. So where we used to involve in most of the seminars or webinars, whatever it is. I'll once again wish you happy Hanuman month, or I can say Hanuman day. So 10th we have recently celebrated. So seeking the blessing from my guru, as you all know that and he is my professor, Dr. V. Guru Prasad. So he's my one of the guru. So under him, I have practiced, and myself I made my homeopathy journey with Dr. Guru Prasad. He's a principal of GHMC. Yes. So, and he is my yoga, my guru, I can say. So Iyengar, BKS Iyengar. So he's my role model in terms of maintaining the physical fitness, mental and emotional fitness. So that is possible by practicing yoga. Being a yogi and being a homeopath, I could able to connect. So both the systems as the integrated approach treating the conditions. So before starting, so as Socrates rightly said, the secret of change is to focus all of your energy, not on fighting the horde, but on building the new. So this is rightly, so we can compare this Socrates saying to our homeopathic practice. See, most of the time we may success in our treatments by giving similimum. So sometimes we may fail. So we have the failure cases also. But what's our potentiality? What's our scope? So basing on that, we have to look for the new cases. Yes, we should gain the confidence out of this and need not to worry about the failure case. Of course, we need to learn from the failure cases, but again, we should not dig into that. We have failed in those cases. We cannot able to take it again. No, it's not like that. We need to work on our potentiality. So let us trust our potentiality as homeopaths. Yes. So objectives of today's session. So let me explain. Is about how yoga can complement homeopathic treatment and why we need in our day-to-day clinical practice. Since I've added my journey of homeopathic practice with yoga therapy, so I have treated some n number of cases. Okay, so where I have found that so just with the medicines, it can be any medicine. Okay, but as I'm a homeopath, I just felt just with the only medicine we could able to treat the patient for about 50 to 60%, but remaining things we need to give importance for something called diet and regimen. So in that I have selected yoga therapy is the best complementary therapy to the homeopathic therapy. How it is going to be helpful, we'll discuss that. And we are going to learn about Hahnemann concept of diet and regimen and effectiveness of homeopathy and yoga in management of chronic diseases, something like atherosclerosis and type 2 diabetes mellitus. So there are many other cases. How best I can able to give to you today, we'll see. So I have taken 2 cases. So if possible, we complete that 2, or we can have a one more session if you permit. Yes. So what's the need of our this homeopathy and yoga therapy in our practice? How it has origin? That's as I said. In our clinical practice, we have been facing, in spite of similar rightly selected remedy, there can be obstacles to complete the cure. So in spite of your selected remedy, similimum has been given, we'll be very happy to know about post-prescriptive analysis that yes, definitely we have prescribed the right remedy still. So there can be after once the patient come for the follow-up, so even the right selected remedy can be failed, right? So you have been experiencing the same in our practice. But so we need to understand that, so why it has been failed in spite of similimum, there can be some sort of, so antidote to that remedy. So reducing the action of that remedy through our diet and regimen. So that is one thing it has made me to think. So for homeopaths, we need to be very much careful. Which are the factors which are causing obstacle to cure? As I've read in my BHMS studies, so for example, from 259 to 263. So let's have a focus on those. Yeah. So what, for example, 259 says, considering the minuteness of the doses necessary and proper in homeopathic treatment, we can easily understand that during the treatment, everything must be removed from the diet and regimen, which can have any medical action, in order that the small dose may not be overwhelmed and extinguished or disturbed by any foreign medical irritant. So what Hahnemann rightly said, so we have selected the potency with the minuteness of the medicine. So there is no, quantity of the medicine. So we are selected on the dynamic force. So these are very much sensitive with the what kind of diet we used to take. So, and also regimen, see, diet is, what we take, what we consume. So in terms of food, water, or fruits, vegetables. So it can be even the medicines along with our homeopathic medicines, so other medicines, okay, conventional medicine. At the same time, what do you mean by regimen? So regimen is the lifestyle where we need to engage ourselves with some exercises. So keeping ourselves active through some kind of modifying our body movements. So that is about the regimen. So which can have medical action. So if it is food or diet, what we consume, food, what we take. So if it is more of spicy, hot, so that can sometimes, or if it is rich in camphor mixed with that, or it can, if it is caffeine contents, that those are easily antidote our rightly selected remedies. That is possible. So even we have appreciated those kind of, witnessed those kind of negative results after the medicine, right? So along with that, so regimen is very, very important. What to prescribe along with the medicine. So what kind of food we need to suggest? That is what we need to understand here. And along with the diet, is it sufficient? Only diet is sufficient. Along with that, we need to focus on what kind of movements if you follow. If the patient is, if the subject is suffering with some conditions like abdominal pain, or it can be cramps, or it can be neck pain, it can be radiculopathy, pain maybe because of radiculopathy. So lumbar radiculopathy, lumbosacral radiculopathy, or it can be cervical radiculopathy, spondylosis. So usually sort of these kind of conditions. So here regimen aspect, so guiding the rhythmic controlled movements is very, very important. So those kind of things, what I have got through yoga is what I'm going to explain. Then, so what's the 260 aphorism says? Hence, the careful investigation into such obstacles, so to cure, is so much the more necessary in the case of patients affected by chronic diseases. Here, very important while treating the chronic diseases, this diet and regimen. So what to advise to the patient, what not to take what patients should not take the sort of food. So that is very, very important, especially in the chronic diseases, as their diseases are usually aggravated by such noxious influences and other disease-causing errors in the diet and regimen, which often falls unnoticed. So without knowing some, most of the time, so we'll be giving the medicine, but if you're not correct in the diet and if you're not advised the regimen, so we'll be in the failure. So we'll be just, there can be temporary improvement. Again, there can be aggravation or recurrence of the complaints. These are the in clinical practice we used to see every day. So most of our practice. So for that, especially in chronic diseases, as our master says, very important diet and regimen is we need to focus. So 261 aphorism. So in this aphorism, as he has told, most appropriate regimen during the employment of medicine in chronic diseases consists in the removal of such obstacles to recovery and in supplying where necessary the reverse. Okay, so if already patient or subject is taking those kind of foods, we need to ask him to stop immediately. So then immediately we afterwards you could able to see the recovery state. So recovery state easily appreciable. So that is what he said. Innocent, moral, and integral recreations, active exercises in the open air. Here the regimen comes. Exercises, we need to advise the patient to in open air, and exposing to the sunlight is very, very important. Almost in all kinds of weather, even it can be summer, winter, rainy season. Also, we need to expose, of course, in winter and rainy season to open air, especially with sunlight. So they have to expose. And suitable, nutritious, and unmedical food and drink, etc. This is about the chronic diseases where importance of diet and regimen. So our master has explained. So if you come to the acute diseases also, so diet and regimen is important in 262 aphorism, except in cases of mental alienation. So patients with mental disorders, all those kind of things. So you need not to worry about the diet and regimen, but it's very difficult. But other than that, so having during fever, it can be any kind of acute pharyngitis, or it can be retrosternal burning. So typical gastritis, okay, or even during acute dysmenorrhea cases. Okay, so these kind of cases where acute conditions are typical, simple painful conditions, we need to focus on the diet. How much water has to be taken. So whether the regimen or exercise has to be advised or not. When it's severe pain, no. So no exercise at all, no regimen, typical regimen. Has to be given rest. Rest is the best. So this is about the acute diseases. So how diet and regimen is important. So come to the 263rd aphorism. The desire of the patient affected by an acute disease with regard to food and drink is certainly chiefly for things that give palliative relief. So this is something like, so patients who are struggling, okay, say for example, having a high fever, right? So our child, so children's may decide for something, craving. Okay, so something they need to be satisfied with. So asking for lemonade, so asking for typically a kind of sugary thing, a sweet thing. Okay, so asking for typically, so craving for some sour items during acute or even in the chronic conditions. So we need to give importance for that also. So here, considering food is very, very important. Even what patient desires. Okay, that is, it may be palliative relief for the patient, but we need to provide what he has, but in moderation. If it is excess also, there can be aggravation of the symptoms. So this is what we need to learn about in the 263rd aphorisms. So from listening about these aphorisms from 259 to 262, is very clear that Hahnemann has rightly told to follow diet and regimen strictly in all the conditions. It can be acute or it can be chronic, right? Yes. So why I have selected this homeopathy and yoga concept? So why it is similar? So why I have selected only yoga to homeopathy? Why not something called gym, going for gym, practicing gym or gymnastic or some other modes, right? But why I have selected yoga? Only yoga I have selected. So this is the result. This is the answer, right? So there's something called, what is the similarities between homeopathy and yoga? So yes, cure, as we know that. So our main aim is to cure the condition, rapid and gentle and permanent. So this is our concept, right? So in yoga also, it may not be a rapid cure, but there can be gentle, and without harming the patients, we are going to suggest, or we are going to make the person or patient to go for rhythmic and systematic movements. So that is one thing. And it can also be a permanent relief. I have seen most of the cases, in many cases, so where yoga itself has prevented the condition, at the same time cured the condition. So I can give the list later, right? Then we will come to the similarities. Is there any so-called side effects or bad effects? Of course, in homeopathy, we don't say there are side effects, but if there is remedy which is mistakenly taken, or so if it is a wrongly selected remedy, can cause partially indicated remedy can cause some symptoms, but it's only temporary. It's not like causing organ damage conditions. It's not like that. But in yoga also, there is never we are going to find the complications or bad effects, okay, by practicing, right? Now, so what kind of generalized improvement in homeopathy? As you know that generally mental level, emotional level, and physical level, of course. And in yoga also, after practicing, so if you sit for pranayama or rhythmically, systematically, if you follow some simple yoga posture, how best you could able to feel, what best you can able to feel after the posture, after the relaxation techniques, at mental and emotional level, of course, at the physical level, you feel that effect at the level of physically, mentally, emotionally, the same thing. So what after the post prescription, so once we prescribe the remedies, we'll ask for the patient to come for the follow-up. So we'll be looking for the generalized improvement, right? The same thing we are going to appreciate in yoga, right? So this is what you need to appreciate. So what are the chemical changes occurs in homeopathy? So as we know that by selecting the right remedy, so we feel generalized improvement that can be possible because of there can be increased secretion of endorphins, so-called happy hormones, or serotonin level. That is through research, many research we have found out, right? So in yoga also, it is clear that secretion of alpha waves, so-called endorphin or serotonin or oxytocin levels after the yoga, if you go for measuring these kind of hormones, we'll see there is an increased level of these hormones. So that means, so through homeopathy also, we are going to give a comfort zone, I mean a comfortness, a happy nature that is also possible by yoga. So the similarity, the simillimum is going to become more dominant through homeopathy and yoga, what we need to appreciate. Yes. Now, so after the remedy, so we do expect, like, increased perspiration is a good sign after it is suppressed or in going for the urination. So as there is a very lack of urination, less urination, or going for defecation, going for the lavatory frequently, or it can be 1 or 2 times increased to take out the toxins, right? So that is one of the appreciable improvement changes we see after the prescription. Okay, the same action. So after practicing any kind of postures, if it is repeatedly practiced, so advised after doing pranayamas or some cleansing kriyas in yoga and naturopathy, the same action is there. So they feel very much comfort after passing urine or after passing stool. That is how they will be release the toxins from the body. So that detoxification happens, right? Now, so after the remedy, so how the recovery state as occurs, right? So I'll come to the yoga. So as we know that recovery in homeopathy, yeah. So recovery state, the same action as we seen in homeopathy. So the improvement state can be carried at, once after they practicing yoga for some duration, so they'll be carried by regular guided by practices, so they can able to maintain the same status quo of improvement. Okay, so they have to be in touch with postures, pranayama, and a sort of meditation. So that has to be practiced to continue the same mode of feeling good or cure. Okay, as our Professor Vitalko says, the long-term benefit of homeopathy to the patient is that it is not only alleviate the presenting symptoms, but it re-establishes internal order at the deepest levels and thereby providing a long-lasting cure. Right? So when the right selected remedy not only alleviates the presenting symptoms, but also there can be inner, it works at the subconscious level. We can able to take out the ailments, even though if a patient has not told to the doctor, but patients can appreciate there can be deeper changes in their system. So that is possible. At the same time, so working for the yoga, or those who are practicing yoga systematically, they can also appreciate the same. So that it will be cleansing not only at the mental, emotional, physical level, so all together at a time. So they can feel the inner cure. So we can call it a deep cure. We can call deep cure. It means at the level of mind, emotion, and at the physical level. Yes. So why only yoga I have selected along with homeopathy? So that's the question. See, yoga, as we have seen that since from the beginning, or you can call, so we can say we can advise to the children around 4 to 5 years of age. So till the last breath, we can able to involve some other aspect of yoga. It can be yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, samadhi. Any one branch of Ashtanga yoga will be in touch with that. That is possible. Is it possible with any other physical fitness therapies, or we can call it as any kind of other transformation physical movements? It's not possible. You cannot keep it for the lifelong, but yoga is the only one. So without harming anybody, it can keep you active, healthy, and to connect to the higher level. That is possible. So that is what. And as homeopathy, it is a holistic approach. Yoga is also a holistic approach. So it is the lifestyles that is you have to carry for lifelong. That is what yoga. So why I have selected yoga is because of this. Yes. So what is the need of yoga to homeopaths? This is what we have studied. So keep it in a simple. Okay. So our higher energies, our homeopathic medicines, are dynamic energy. So the vital energy. So the medicines. Okay. So it has to reach to the society. It has to reach to the needy people. So we are prescribing the higher dynamic potency to the patient, right? So it has to reach. It has to connect to the patient at the higher level. Okay. So just by giving the medicine, we may expect the result by 1 month. So when you're going asking for the follow-up for 15 days or 1 month, depending on the intensity, but we may not expect the amount of cure what you expect. So after once a patient comes, right? So to enhance the speedy recovery, to intensify the cure process, since both yoga and homeopathy and yoga complement each other through those are similarities, it can enhance the speedy recovery. Okay, this is why I selected yoga is complementing to homeopathic therapy. So this is the need of yoga to homeopaths. So being homeopath, so knowing about the yoga, how yoga is going to helpful to the patient. So with our medicine, if you club with some yoga postures, therapeutical yoga, so I call it as a therapy. So therapeutical yoga postures, a pranayama, or some diet aspects, then cure will be definitely, and it is the cure will be at the higher level. So this is what I have selected, and this is the need of for homeopaths. Need for homeopaths. Yes. So let me explain some aspect of how it has helped to the patient, the complementary approach of homeopathy and yoga. So this is a patient, it's a female patient, so aged about 29 years. So she's a homemaker. And once the first time she approached me, so it was 2018, December 22. So presenting complaints. So intense claudication pain in the right thigh. So since 5 to 6 years, so which has aggravated since 2 to 3 months. So she used to complain that I can't able to walk even for 100 to 200 meters. I need to stop or I need to take rest. Otherwise, there will be intense pain in my right thigh. So that would upper 1/3 of my right thigh. So she used to cry out of pain. So the pain will be persisting for about more than 1 to 1.5 hours. If she gets the pain may persist for more than mild pain will be persisting for 1 to 1.5 hours. So much of struggle she used to experience for about 5 to 6 years, but since 2 to 3 months, it has aggravated. Yeah. So let me talk about that symptom, since many students are there. So I've taken as a typical case taking. So location at the upper 1/3 of right thigh. So sensation, she used to complain that there'll be severe like catch or cramp like pain I used to feel in my thigh, right thigh, or sometimes there can be somewhat some stone has fallen on my thigh, like a tight feeling she used to feel. So extending till the right knee. So pain persists for more than 1 to 2 hours. When she gets the pain, it persists for 1 to 2 hours. So if you consider the cause, she had traveled to visit temples surrounding Tamil Nadu state for about 1 week at that time. So afterwards, the intensity of pain got aggravated. She used to get on and off pain. She used to visit many allopathic doctors. So they used to give the painkillers. Okay, so she will be temporarily better, but again, whenever she strains herself, whenever she going for a walk, a brisk walk, she gets the pain immediately. Then used to stop. Then she used to stop the going for exercise or walking. Also, she used to stop. So this is what, since there will be exertion, pain is more. So modalities I've taken: aggravation walking for about 100 meters, has to stop walking in between. So aggravation by climbing steps, better by hot water, by massaging, and by inverted leg position. Okay, so whenever she stands for long minutes or long hours, there will be increased pain in the right thigh. Okay, if she is going for inverted legs, if she raises the leg, taking the wall support, lying down and raising the leg onto the wall, she feels better. Temporarily, there'll be feeling of better. Okay. So along with that, there will be during the pain and before the pain, she feels. Okay, that means if she walks for some 100 meters, she feel the numbness at the right thigh. Okay, or even till the level of the right knee. And she feels formication. There's a sort of ants crawling on the thigh. So that was the feeling she complained. That too during pain. Whenever she has the pain, there will be a sort of there'll be pain, and she has to rub, or she has to feel feeling like scratching, since she feels that some insects are crawling. That is called formication. Yeah. So I just took the pause history. She was the known case of congenital heart disease, acyanotic coarctation of aorta. As you know, that will be obstruction or narrowing of the arch of aorta. So one part of the aorta. So that is called congenital heart disease or coarctation of aorta. With she was having at that time. So when she had the symptoms, so she had symptoms like difficulty in breathing, and headache and uncontrolled hypertension. So because BP was not coming under control, she came to know when she has gone for some different tests like going for echo or other parameters. So she came to know that she has diagnosed as coarctation of aorta was the condition. So because afterwards that BP is not coming under control, she has to visit many doctors. Then they said that the only thing is they have to go for the surgery by stenting. So by on 11/1/2010, successful stenting of coarctation of aorta is done. So transcatheter, that is CP stent. You know that Catham platinum is called CP. So stent by using femoral artery via. So transcatheter of that CP stent has been done by femoral artery. So okay. So surgery has they have put the stent to the coarctation part. So then she started pain in the right thigh after 2 to 3 years after femoral for stenting. So she underwent stenting. She was better for 2 to 3 years. There was no BP was under control. So other medications she used to take to control the BP, of course, and headache, breathing difficulty, all those things were better. Okay. But so after the surgery or stenting, after 2 to 3 years of later, after that, she started with pain in the right thigh. See, so by seeing this, hearing about the past history, so we need to know about what has happened there. Okay, so they use the femoral artery for the stenting transcatheterization process. So they did the catheterization, the stent has been fixed. But so what happened to the area, femoral artery? Okay, so after the surgery after long years, so complications we can call or side effect of those catheterization, there can be narrowing, there can be plaque formation, right? It is one of the complication of stenting. So this is what we need to know about the pathological aspect. So particularly femoral artery. Then because of that pain, she struggled a lot. So again, she went for the cardiologist opinion. So he advised for the color duplex study of right lower limb arteries. Okay. So on 14/4/2014. So 15. Till then, she was just thinking that, so this is just a pain, maybe overexertion she used to cause. She used to take medicine, all those kind of things. So no one has diagnosed. But once it is more, she is typically developed claudication pain. So doctor has suggested to go for the color duplex study of right lower limb arteries. It showed. So it says short segment stenosis of the common femoral artery with severe stenosis at the bifurcation. So you know that. So femoral artery in the femoral triangle, it divides into superficial branches. It gives into superficial branches and the deep branches. So superficial epigastric artery, circumflex iliac artery. Then the deep branch will be profunda femoris artery. So there exactly. So there will be severe stenosis. So because of the stenosis or atherosclerosis, there can be plaque formation. So she used to get the severe pain. Okay. Then dampened flow in the lower limb, distal to stenosis, of course. So distal to stenosis will be decreased flow, blood flow. Okay. So I took the family history. So father was diabetic and hypertensive, and personal history, she craves for sweets. So most of the time, so she prefers sweets and salt 1+. So sleep disturbed due to thoughts. Okay, since 2 to 3 months. So as I told, the intensity of pain in the thigh has increased since from 4 to 5 months. Okay, so disturbance of sleep could be even because of there can be some thoughts. So what kind of thoughts we'll discuss? Okay, so thermals, she was towards warmth, and the BP when I checked, it was 150/100. So the during whenever she has that severe pain, that time also BP will be more. So considering complaints, so okay, and understanding the pathology and family history, and as it is a congenital complaints, I have selected as psychosyphilitic miasm. Okay, now it's very important. So come to the mentals. Okay, so she was worried and cried after asking about family. Okay, so I generally take the mentals by. So generally considering the whole family, so how we are with the family, everything. So see, generally for the first time they're coming to the homeopaths, they don't know how to reveal about their mind and emotions. So we need to ask from the periphery, then you can able to get the points, right? Yeah, so this is very important. Mother-in-law used to curse her always for trivial mistakes. For small mistakes, she used to point her. So she never gave back answer to her. So just keeping in her mind, keeping her, holding in her mind, holding in her mind. So, but for 5 months back, mother-in-law started scolding her in front of relatives. Okay, so this, talking when mother-in-law used to curse her, used to scold her for many mistakes, but she never gave back after the marriage. But 5 months back, before coming to my clinic, so she fought with mother-in-law. She gave back since there was, the wounded. So she was wounded. Honor, the honor was wounded. How? So mother-in-law scolded her in front of her relatives. So for some programs, so all the there in the house, all the relatives at that time, so she scolded her daughter-in-law in front of relatives. At that time, she couldn't control her anger, and she started scolding very badly to mother-in-law, and even she raised her hand towards her, it seems. So this is what they told, even including her husband said like that. She was so calm, she was so sweet lady, but at that time she couldn't control her anger. She just expressed it. Likes to stay alone after that incident. So after that incident, so she used to avoid mother-in-law, and whenever her husband or anybody, so when her mother talks with her, she feels comfortable. Okay. So usually what I got from her, so by considering all the things, she doesn't want to hurt anybody. So, but she couldn't control that. So outburst of anger, she couldn't control her threshold. So just came out with a strong, fight back. So if you can able to see this, please zoom it, and you can look of this. So let me read the report. Okay. Yeah. So this is about the color duplex study of right lower limb arteries. This is done in the year of 2015. So first they have done this short segment stenosis of the common femoral artery with severe stenosis at the bifurcation, as I said, and dampened flow in the lower limb distal to stenosis. So this is about the first color Doppler of right lower limb. Okay, then immediately they've asked you to go for the CT. Okay, CT lower limb. So what it says, CT again, suggestion of an elevated intimal flap with significant focal short segment stenosis, more than 70% narrowing. Okay, so just focus on this. More than 70% is severe one, involving the right common femoral artery before the bifurcation. So more than 70% block was right. Otherwise, no other stenosis. Okay, so femoral artery stenosis is what we need to observe. Okay. Yeah. So considering all the mental symptoms and family history and desires, okay, personal history. So what medicine we can able to think? So anybody, you can type or you can unmute yourself and please. So if any students are there, so most welcome. So seniors are there, so we'll be knowing. So whoever, please come out of the remedies by considering mind symptoms, emotional turmoil, and family history, personal history. So what we can eat, what it comes, what are the medicines we can think of? Very good. Dr. Anil sir says, so Dr. Manjula says, Matamur, fine. Anil sir says, Staphysagrina. Anybody? Anybody? Yes. Yeah. See. So have selected the remedy, Staphysagrina. So as Anil Kumar sir rightly said, thanks sir. Thanks for your input. Yeah. So why I have selected Staphysagrina? What could be the mind of Staphysagrina? Okay. She will be very so sweet natured. Whoever scolds, so whoever talks on her, so she never bother. God is there, so I don't give it back. I never give it back. I don't want to hurt anyone. Even though in spite of hurting me, I never give it back. So this is what the state of Staphysagrina, you know that, right? But what made her to come out of so much of even though she has raised her hand like to beat, right? After after that incident, how was her mind? How was she was feeling with that? That is also very important. So we get confused with Netrumor and Strepsagria here, right? But why I selected Strepsagria? After the incident, after she fought with mother and she felt very much insult, but she was better. She was better with consolation, right? This is very important. Her husband and mother, she talks, she feels better with that. But in Netram mode, they never feel better immediately or whatever it is. Consolation, aggravation all the time we see. But Strepsagria is something like that till the threshold level. They can able to bear the pressure. They can able to carry the burden. They can able to hear the words. But once they feel their subconscious mind is completely damaged because of the words, they will come out of with aggressiveness. So with anger. Strepsagria 3+ in rubric. In anger rubric, Strepsagria is 3+. When there is a threshold is broken, they will come out with a strong element of anger. Even though so sweet lady, she could able to going to hit mother-in-law means so much of hurt. That is one of the things. But after that, what happened? She was better with consolation. If there is no better with, she's not better with consolation. Think about Netrumor. Yes. So I gave the remedy 10M. So basing on the mental and emotional factors. So after 1 month, she was feeling better, generally feeling better. Intensity of pain in the thigh, so is about 30 to 40%. The claudication pain was better for 30 to 40%. Sleep very much better. So generally she was very much better. So 90% sleep was better. So I just waited for one more month, giving the just cyclac. Okay. So this is December. Okay. Then this is April. Okay, April 2019. So this is 2018 December. So they didn't come. So they felt better. She felt better. So even I told them to follow it up. So for once in a month, but she was feeling better, it seems. So she waited for 3 to 4 months. So in month of April 2019, so again severe pain in the right thigh after returning from the trip. Again they had been to trip during summer vacation. So she took painkillers because the pain was severe, but didn't get relief much. Okay. So as we say that the right remedies worked for about 3 to 4 months means, so the remedy is, is the minimum. So where then again, if there is a repetition, we can repeat the dose twice, or that is called double the dose of previous remedy. So I repeated only 1 dose I had been given for the first time. So I just repeated twice within the gap of 3 days. And again, I'll ask her to wait for 1 month. Okay. Here, see, this is till the first prescription. Okay. So then the follow-up, I just focused on the remedy. Okay. So with our remedy. But again, the intense pain started after 3 to 4 months of the medication. Okay, it can be medicine aspect. It might have it might have antidoted. Okay, there's one thing. But when there is a same severe intensity, a pain is she was struggling like anything, means that is the need of complementary therapy. So that is the time where I felt that. So this is the time when I need to guide her through yoga therapy. So I started guiding her to follow along with the medicine. So for 1 month you need to practice. So these are the we can call it a therapeutic list. So for the atherosclerosis or any narrowing of the arteries. So if it is atherosclerosis, arteriosclerosis, what do you say? So or any heart condition also. So these are the postures or pranayamas we need to suggest. Okay. So I suggested there is something called upward faced dog posture. We call Urdhva Mukha Shvanasana. It's a dog posture. So it's like almost, it resembles like a Bhujangasana posture. So duration is for 30 seconds. Each cycle has to be done for 30 seconds. I told them to ask them to, I asked her to repeat for 5 times a day. Okay. So once if she starts, she has to hold it for 30 seconds and she has to repeat 5 times at the gap of again 10 to 15 seconds. So each repetition, there will be 10 seconds gap. Okay. For one posture, 30 seconds she has to hold like that. By practicing this, upward dog posture, upward faced dog posture, typical like Bhujangasana, there will be increased, okay, blood circulation. There can be contraction of the cardiac vessels. Okay, so cardiac muscles and blood circulation itself to the cardiac muscles. Okay, and there can be compression of the cardiac muscles, that will increase the blood flow through the aorta and to all the parts of the body. Right, the force, the pressure of that, pumping, blood pumping will be more, so that it will push towards the lower extremities and upper extremities towards the head with the force. The force will be maintained. So even though if there is a narrowing, so there can be at least instant increased blood flow will be there. So by practicing this upward dog posture, it is going to dilate the blood vessels. This is one thing. Then I suggested Trikonasana is a triangular posture, so side bending posture. So she has to practice both the sides. See, if she has the pain, so whenever we suggest the postures, they have to start from the painless area or painless side. So she has the pain in the right side, she should not start with the right side posture. She has to start with the left side, then she has to feel comfortable, then she has to go for slow and rhythmic movements in the right side. That means painful side. So I suggest to go for the both the sides. First start with the left side 4 times. Okay, so totally she has to practice Trikonasana left side once and right side once, so 2 times, then again once, each posture. So 4 times she has to practice. For each Trikonasana, 30 seconds she has to maintain. Okay, by practicing Trikonasana again, so there can be venous return. Since we'll be standing on the one leg, okay, we can enhance our calf muscle. We can increase the soleus muscle. Okay, so the girth of the soleus muscle, which is going to compress the sinusides, valvulus sinusides, which push the blood circulation to venous circulation towards the right atrium, the right ventricle to the lungs. Then there can be increased pressure of the heart by practicing upward dog face dog posture, so that there can be a good amount of blood flow to the peripheral vessels. Okay, that is one thing. Then I suggested them to go for Padangusthasana. So I'll show the posture how she has practiced. Okay, in the next slide. So this Padangusthasana is now holding the lying onto the spine. Okay, supine position, raising the leg, holding the big toe with same hand, like right hand, right big toe. So holding for that with a reverse inverted posture, so it can take out the blocks or block formation. It unfolds the vessels. So that is one of the very useful posture. Then there is something called Ananthasana. So like how Lord Vishnu sleeps, the same posture is lateral position where you're going to raise the leg holding the toe, right? That also effective posture to unblock the vessels. Okay. Then Viparita Karni is the best posture, I can say. A simple posture where she has to lie down onto the floor and just raising the legs onto the wall. That's it. She maintains that posture for about 3 to 5 minutes. Okay. So before, early in the morning, before starting practice, or once you come back from the work, like, so household work will be there. Once she is returning to the bed, if she can able to practice this Viparita Karni, she can able to prevent the pain. So this is one of the best posture, Viparita Karni, for the legs pain or any kind of blocks in the lower limb. Okay. Then I suggested pranayamas. So in that Surya Bhedana pranayama, I asked her to repeat whenever she practice 5 repetitions she has to do. So what it does Surya Bhedana? Surya means is the right nostril. Okay, so right is for sun. Okay, it is going to open up the clots. It's going to increase the blood circulation. So practicing Surya Bhedana is very, very important if they have any clot formation or atherosclerosis. Okay, so especially for the post-COVID affection patients where you'll be struggling with breathlessness or cardiac condition, so they have to look for that. Okay.
Thank you. And excuse me, I sorry to interrupt. As it's a time to stop the session because we need to go for the Malayalam session and we need another class. Not another class. I think you are having lot to share about yoga and homeopathy. You're a very learned person. We need you here again. So this now for the day, I am going to conclude the session and I am asking Dr. Manoj to say the vote of thanks.
Thanks so much. Or can you give me a 2 minutes time, sir? last 2 minutes. I'll just finish first case, at least first case.
Yeah, you can. Then we are thanking you for the session, and we will be going to the Malayalam session. And you please conclude your concluding remarks we need. Thank you.
Yes, thanks so much. So, Brahmari,